me, Anna, if you want me to.
Okay. Oh, Andy's done it. It's all right. Brilliant. Thank you, Andy. Thanks. Great. Okay, I'll give 1 more minute for people and then I'll make a start, I think. Okay, let's make a start because we've got quite a few people here and other people can join as we go along if need be. Are you all right, Andy, to let people in as they join so that Jodie and I can kind of concentrate on the talking? Thanks very much for joining us tonight, everyone. My name's Anna Pettican, if you haven't met me before. I'm an occupational therapist and I work part-time at the University of Essex and part-time for Sport for Confidence. And this evening, I'm going to be presenting with my colleague from the university, Jodie. Do you want to introduce yourself, Jodie?
Hiya. Yeah, my name's Jodie. I've got my undergrad and masters at the University of Essex, working mostly within sports and exercise science. So it's been really nice to join Anna in with this on this research project, kind of looking at physical activity alongside living with a disability. So that's me.
And this research study that Jodie and I are presenting tonight has been undertaken within the context of the Moving Occupational Therapies programme. And in recognition really of, as a profession, we have quite a fragmented evidence base, quite a limited and quite a fragmented evidence base in relation to occupational therapy and physical activity participation. So this study has been undertaken in part to try and address some of that. Those of you who have joined since I said, we are planning to present for about 30 minutes and then to have some time for questions. And also we've got some sort of discussion questions to share as well to promote discussion afterwards for those of you that are able to stay on beyond the presentation. Okay. Okay, I'll start sharing the slides. Can people see the slides okay?
I think share your second screen potentially so we can see the notes.
Oh, sorry, I've shared the wrong one.
Easily done.
I'm not used to MS Teams, I must confess. We use Zoom at the university and I'm a bit of a MS Teams, I've got no idea really. But anyway, we'll get there. Okay, great. Welcome to our presentation. So just to give you an idea of what we're going to cover this evening, we're going to start off by talking a bit about participatory research. That was the specific approach we used for this research study and what we mean by participatory research and research methods. We're going to spend a bit of time defining some key terms, give an overview of the existing knowledge base. We're also going to talk specifically about go-along methods and what those are. And why they were quite central to this study. We're then going to share the findings from our study and finish with some implications for occupational therapy practice and our references. And then, as I said, the opportunity for questions and discussion points at the end as well. So what do we mean by participatory research, or indeed what do we mean even by research? I think sometimes research can seem like this slightly alien, scary word. I always say to people, you know, research is about new knowledge. That's what research is. And as occupational therapists, why wouldn't we be interested in new knowledge, in understanding things perhaps in new ways or in better ways or in more in-depth ways, and using that understanding and that new knowledge to support and inform our practice. Participatory research is a particular way of doing research, and I think it's probably best summarised as doing research with people as opposed to on or for people. So it does have quite a deliberate philosophical commitment to being democratic and seeking to overcome inequalities, particularly among marginalised groups like disabled people, and I suppose, again, in summary, it sees research as a collaborative process rather than an extractive one. It isn't about, just getting data and taking it away as a researcher and doing what you want to do with it. It is about having a relationship with co-researchers, with participants, and working in a very active way in directions that are meaningful to them throughout the research process. The study that we've undertaken was funded by Research England, in particular a pot of money that they have called the Participatory Research Fund. So as some of you might know, there are increasingly shifts within research to ensure that there is patient and public involvement, that people for whom the lives are affected by the research or the research topic relates to their experiences, they are actively involved in shaping and informing the direction and topic of research. And this fund is really an acknowledgement of that, but particularly it was a funding call that wanted people to undertake studies that tried out participatory research methods. So it was quite an unusual call in some ways, in that it was a call that was about research methods and doing research on a research method rather than a conventional research project. And I worked with Sport for Confidence and people at Sport for Confidence to develop an application, which very fortunately was successful. And that funding partly funded Jodie's role. So Jodie's been working on the project since the beginning of the year with me. And that's been really helpful, because what's been really important about Jodie and having Jodie on the project is that she's been able to devote a lot of time to having a lot of contact with the co-researchers, with the Sport for Confidence participants that worked with us in the project. And that's really valued and seen as really important within participatory research processes, that you're not just having contact and having spaces to collect data in a conventional sense, but you are actively creating other safe spaces to have phone conversations, to exchange messages, to have email, to really work with people and get to know what's important about the research for them, what direction they feel the research should go in, and that it does become a very collaborative process. So Jodie's role was valuable in lots of ways, and Jodie's been valuable in lots of ways, but in particular, I think thinking about a participatory research process, having Jodie to kind of really build that rapport and collaborative working with people has been really valuable. So we did start off with the original research aim. Jodie's going to talk a bit later about how the project actually evolved to have this first strand and then a second strand, and that is the second strand we're focusing more on this evening. But the original research aim, as I've said, was to look at a method called go-along interviews, and I'll say a bit more about what those are on the next couple of slides. But it was to co-produce knowledge about the usefulness of go-along interviews as a method for exploring physical activity participation and provide insights into Sport for Confidence participant experiences. And I think before we go any further, it is also important to acknowledge here that we are well aware there are some limitations to the study, not least that it was undertaken within one leisure centre. It involves a leisure centre in the east of England that had Sport for Confidence in that leisure centre. So undoubtedly, people's experiences would be different. For example, if we undertook this study in another part of the country, particularly in another part of the country where there wasn't Sport for Confidence, and people were talking within the research process about their experiences of Sport for Confidence as well as their experiences of the leisure centre. So we do acknowledge that. And we also acknowledge that we recruited co-researchers, we recruited participants from a particular Sport for Confidence group session at the leisure centre, and we'll say a bit more about why we made some of those pragmatic decisions a bit further down the process, but I just felt it was useful to mention that now. So as I said, We also thought it was worth here just defining some of the key terms that we're using in this presentation. And this isn't because we think any of you don't understand what physical activity is, but it's just so that we're all starting from that point of shared understanding, really. And this first definition here might well be one some of you are quite familiar with. It's probably the most commonly used definition of physical activity. Certainly the World Health Organization adopt this definition. It's been around a while, as you can see there, since 1985. And this is quite a distinct definition. The thing I quite like about this definition, if it is inclusive of physical activity that's undertaken within the context of people's everyday lives. As you can see there, it isn't just saying, that it's very defined sport and physical activity sessions that constitute physical activity, but it is acknowledging there that, physical activity undertaken for transport or indeed as part of someone's work, walking up and down the stairs, carrying heavy shopping, would all constitute legitimate forms of physical activity. But this definition has recently been updated. So there's an interesting paper for those of you that want to read more by a guy called Pettican that was published a few years ago. And he's very deliberately taken up this position of, actually, as this field's moved on, we need a more inclusive definition of physical activity. And actually, what I really like about Joe's new definition, particularly being occupational therapist, I think, is that he acknowledges the kind of breadth of what might constitute physical activity, but also for us, I think, the role of context and the environment in shaping and influencing participation in physical activity. I think there's things about that first definition which are quite medical, very much focused on the individual and notions of energy expenditure and skeletal muscles, whereas this definition I see as being much more inclusive in acknowledging context and environment. And then the next thing to say briefly is to define go-along interviews. So what do we mean by go-along interviews? And you might have heard go-along interviews also referred to as walking interviews. I don't tend to use that term because as you'll hear within the context of this study, you're often doing these interviews with people who aren't walking. They may be mobilising in wheelchairs and things. So that's why I prefer the term go along. It is a mobile method. It sort of draws on the idea of show and tell, moving around a space with people. In terms of this study, that was a leisure centre space. And it is seen as being a participatory method because it's seen as being particularly democratic. So for example, that the interviewee sets the pace and direction of the interview, both literally and metaphorically. As you move around a space together, they can pause at a particular point if they want to. They can kind of walk quickly or move quickly in certain spaces, or, it's up to them where you go first, where you go second. They're very much directing the interview in a very different way to a sort of conventional static interview in a room. Having said this, and Jodie will share more about this in a moment, we did rather on this study play with what we meant by the term go along, and actually we adopted different approaches to what constituted go along, but I won't say any more about that. I'll leave Jodie to give you some more details about that. So in terms of the current knowledge base, the kind of context for this research, I'm sure some of you already know, physical inactivity as a global public health concern, and that similar to other developed nations, we have around 61.4% of adults in England that don't meet the Chief Medical Officer's guidance for participation in physical activity. But actually those levels of physical inactivity aren't uniform. Certainly within Essex, you'll see rates of inactivity that are much lower than that, for example, in quite affluent areas of somewhere like Colchester, and you'll see much higher rates of physical inactivity in areas such as Jaywick and Clacton, where it will go, well into the 70s% of people that aren't meeting those recommended levels of physical activity. So that we know that we have a physical inactivity problem, but we also know that those physical activity levels aren't uniform. They're particularly high amongst disabled people, people living with enduring health problems, and people living in areas of high socioeconomic deprivation. And also, of course, where those factors inevitably intersect often as well. We know people who are disabled and have enduring health problems are also more likely to live in areas of socioeconomic deprivation. And I find it useful to think about the issue of physical inactivity as an occupational injustice, acknowledging that access and participation in health enhancing occupations is restricted by external factors. It isn't fair. Not everyone is having the same opportunities and resources to engage in physical activity. Okay, and I'm now going to pass over to Jodie, who's going to talk to you more specifically about disabled people and leisure centres and what the literature already tells us.
Okay, so yeah, one of my first roles within this project was to kind of really have like a deep dive into the literature, see what we know, see what we don't know, specifically in and around leisure centres, because obviously that is a very kind of core place that a lot of people go to do physical activity. And there was one paper that kind of highlighted that only about mid 30% of disabled adults were regularly visiting public sports centres, leisure centres, and participating in physical activity within group sessions. And whilst kind of this is the one paper that I kind of came across, but if you look in the general kind of literature, you can see that there's a little bit of exploration in around kind of the barriers to physical activity, but there's not a lot that specifically kind of explores leisure centre settings in particular, and potential barriers in and around leisure centres. And so there was kind of some suggestion that there was a paper from within Belgium that kind of reported about 80% of their leisure centres, sports centres to be accessible. But within that, none of these places had elevators, automatic doors, or adapted changing rooms and locker rooms that made such places available and accessible to people with disabilities or long-term health conditions. So, there's kind of that lack of understanding of what exactly makes a place accessible, what makes a leisure centre accessible to someone with a disability. And we want to understand particularly what barriers, whether it's kind of what physical barriers, mental barriers, and potentially even previous poor experiences of being within a leisure centre that might prevent people with a disability engaging in physical activity within a leisure centre. And so kind of using the go along interviews, it really helped us to engage with the people that we want to understand the perspective of the most. So, there's one thing doing questionnaires and surveys and things, but with the go along interview, you can really kind of get a more impactful understanding of that people's experiences, people's understandings. They have more open conversations as well with them, which can be really useful to inform our research. And so, yeah, I think overall it's just kind of, it just helps to amplify their voice more by using this method. So yeah, in terms of the actual methods that we use, following getting all of our ethical approval and everything, we managed to recruit 8 co-researchers, all from within Sport for Confidence at the Riverside Leisure Centre. And we managed to kind of work with them. So initially we joined in with their Sport for Confidence sessions. We sat in with their seated exercise sessions. We got to know them within their session. We also got to kind of gain their experience working with Sport for Confidence and joining in with the physical activity. And from there, it was really useful to build a good rapport with them, and we actually conducted our workshops immediately after the seated exercise session. So that helped to overcome some potential transportation barriers that might have been in place, and it made the facilitation of our kind of project a lot easier to engage with them as well. And so during our workshops, we really encouraged our co-researchers to direct the conversation, talk about the topics that they want to talk about, and in general, this kind of led to talking about accessibility, and that was a kind of a natural progression that we found happened. And with the go along interviews, they chose where they wanted to go. They chose kind of their group sizes, if they wanted to kind of do it more seated or explore the leisure centre. And we also explored with the use of Zoom for some participants that might not have been able to make the session. We managed to get them linked on with Zoom and do go along interviews around the leisure centre whilst on Zoom as well, just to really explore the methods and which ways we can kind of the best ways to conduct different conversations, and how the different methods of this go along interview can encourage different conversations, highlight different problems, highlight different barriers, and yeah, really rose kind of a real kind of variety of experiences through this method. So yeah, that's kind of the methods that we did there. Across our 8 participants or co-researchers, these are just kind of an overview of some of the ages we were working with, genders, and kind of the different disabilities we were working with. I think that's one real big benefit of the group that we worked with. We managed to have a real variety of different disabilities. We had one lady in a wheelchair, we had people living with arthritis, people who've recovered or recovering from cancer or dealing with that side of things, and all sorts. So, you know, we had a real variety of different disabilities, which kind of highlighted to us different barriers and different, and resulted in different conversations and whatnot as well. So, and as we mentioned, going into this study, we initially were looking at the method, and so like we were looking specifically at how we can adapt and use the go along interview to kind of facilitate different conversations in and around physical activity and living with a disability. But because of the freedom that we gave our co-researchers, throughout kind of the workshops and the interviews, the conversation around accessibility and leisure centres within public spaces and was really kind of highlighted, and we managed to gain some really in-depth discussions and collect some really rich data, spanning way beyond our kind of a priori aims of, you know, just looking at the method. So that's when we decided to explore the second strand, and really look into disabled people's experiences of accessibility, specifically within the leisure centre, because as I kind of mentioned previously, we feel there is quite a big gap within the literature in and around that kind of environment. So yeah, I feel as from our kind of 2 strands of research, our second strand looking at accessibility within a leisure environment probably is more apt to discuss here today. And so I think we're going to focus on that, but we'll still give you some ideas of what we kind of discovered within our strand 1 of the research as well. So within our data collection, just to look into it a bit further, we had 5 different workshops, and within those 5 workshops there were 17 go along interviews, and they were in pairs within 3s, as I said, and all of those interviews were recorded and then transcribed, which was really useful. And from all of the transcriptions, we managed to use we used a process called thematic analysis to kind of try and look at the data, identify common themes and common discussions and things that kind of kept cropping up. And from there, we kind of went back and forth a bit with our findings, and we actually arranged a couple of extra workshops with our co-researchers and presented the themes that we'd come up with within both the strands and tried to get their collaboration with it as well, because at the end of the day we wanted to really kind of expand on their experiences and really kind of amplify their voice, and not just push our subjective ideas of all of the data that we've collected. So yeah, we managed to do an awful lot of data, and then off the back of that we managed to kind of, after working with everybody, working with all of our co-researchers from Sport for Confidence, we managed to finalise a good few themes for both the strands of research, which was really good. So in terms of our first strand, so looking at the method, one of the first things that we kind of looked at, as I said, explored, was the flexibility and adaptability and location of the interviews. So kind of really looking at where can we take these interviews, where can they happen. We had some looking around the leisure centre, like I said, and we had some on Zoom, and we found each place that the interviews took place had different pros, different cons, you know, and we had to consider things like privacy of the interview. So on Zoom and being kind of one-on-one in a room was preferable when you're having a more kind of private conversation, but if you're wanting to really kind of explore the physical barriers, moving around and going around the leisure centre and moving around was kind of the best way to highlight that. And another thing that was really interesting that we found was kind of looking at the power dynamics between the researchers and our co-researchers, because quite often throughout the literature you see kind of a power dynamic between your interviewee and interviewer, whereas in the method that we took it was quite a fluid role. There was not a specific researcher, a specific interviewer, kind of everyone posed questions, answered questions, and it was far more conversational, more fluid, more natural, which, while sometimes was hard to kind of direct, it meant that the conversations we had were really open, really honest, and a lot more raw than what you might get from, you know, somewhere there's a power dynamic. You have your interviewee and then your interviewer directing the questions. So I think exploring that was really useful. And thirdly is just looking at the group size. You know, we had a big group workshop, which was great because we had all different opinions, different experiences. One person will say, oh, you know, I really like this toilet, it's really handy for me. Another person goes, well, you know, this is in the way, I can't use this, I can't access that. And so we had different opinions, different perspectives within our group, which was really useful, but some people found that overwhelming. And so having the smaller group sizes was also really good to kind of bring about conversation from all ends. So that's kind of a summary of our first strand. I tried to keep it brief, and we'll kind of move on to our second theme, looking at accessibility within a leisure centre.
So as Jodie said, we're going to spend a bit more time on the second strand findings because we recognise they're probably more relevant and interesting to the audience that we've got this evening. I did also just want to skip back slightly and just to say that in terms of that participant sheet, they are pseudonyms, and what we did actually was we asked people to choose their own pseudonyms. We didn't give people pseudonyms, they chose their own names, and people also identified their own, how they wanted to be described in terms of disability. So they are very much, that is the information they've actively chosen to share with you this evening. So to go back to the second strand themes, in terms of leisure centres and accessibility, this is the first theme, process of participation. And this is the first theme because it's talked about as a bit of an umbrella theme. And by that, we sort of meant that people said, you know, this sort of provided a frame to the three other themes, and they sat perhaps slightly below this theme. The thing to emphasise, though, is that we're not suggesting by this process of participation that everyone rigidly passed through these three phases or stages of participation within the leisure centre environment, but there was a sense from all our co-researchers that certain things needed to happen and be in place for them to commence and sustain participation in physical activity within a leisure centre environment, although the approach to doing that was kind of necessarily individual and client-centred. So the thing people really emphasised was this named in-person support being very integral to them initiating participation and overcoming immediate barriers. And that took various forms. Sometimes people found Sport for Confidence details through, for example, a web search, and they came into contact with the leisure centre that way. Someone called them, sometimes someone arranged to meet them. Someone was brought along from their community mental health team by someone, and kind of they settled them in and showed them around the leisure centre and helped them overcome those immediate barriers. But the consistent thing was everyone saying that initial being accompanied, having named an in-person support was really critical to that initial participation and making that happen. And after that happened, there were, as we've said, there sort of multi-directional. It wasn't necessarily that people moved from 1 to 2. You know, some people went straight to 3, for example. But for quite a few, there was this sense of then joining the structure and routine of group sessions in the Sport for Confidence group sessions, and them being really central to people building habit building. But also them being really central to a sense of inclusion and belonging. And the word people really kept using and coming back to when we were doing this analysis was encouragement, that people felt really encouraged, and that bit communication, checking in and encouragement was really important to them building their confidence in those early stages, alongside having the structure and routine of the group sessions. And for some people, not for everyone, some people were straight at 3. That then enabled that developed sense of confidence, and that structure gave them a bit of a safe, stable base, and that enabled wider explanation of the leisure centre. So often people might then still encounter further barriers and difficulties, but they had the Sport for Confidence resource to come back to. They had a named person that they could come back to within the leisure centre, and they could talk to, and they could check out some of those issues that they've maybe encountered. And this was really important, this stage, for really facilitating inclusion beyond the group sessions, and for them perhaps to develop new habits and routines that could be quite autonomous. You know, that meant coming swimming on a Sunday, for example. Because they'd now got to know the leisure centre staff more, they'd got to know the routine, they knew where the changing rooms were, they knew the lifeguard could see them in and out of the pool pod. They'd got that sort of stable base to operate from, and that being particularly important in supporting continuity and that sustainability of participation over time. So I've just got a couple of quotes here that I'll leave for you to read, that we feel really illustrates this sense of process of participation, and how people had been enabled to participate and develop personally over time. Interestingly, this theme really maps to a particular finding I had from my PhD research, which was with a community football team for people with experiencing mental health problems. And actually, this was called Puzzle of Participation. But interestingly, that there's this real sense of there being certain things that need to happen and be in place at certain points for participation to be successful. And this is really important because actually, although we've got a wealth of evidence that tells us that physical activity and doing physical activity is health enhancing, we know relatively little about what needs to happen to support people, what points, what might cause people to discontinue, what enables people to initiate and sustain participation, and therefore be able to provide much more precise support and resource. So it's really important that we do have research that really unpicks some of those issues and enables us to understand in more depth people's experiences and stages and phases of participation. Yeah, so that's the first theme. The second theme was barriers to participation. And actually, it's what's really interesting, I think, about this theme, and this is something we'll come back to in other themes and in the implications to practice, is to note that several of these barriers aren't specific to leisure centre spaces, and this research has really highlighted, similarly to other research, the interconnected nature of people's occupations and the need for different parts of the system to work together. You know, that actually travel and transport, toilets, parking, all have an enormous impact on people's ability to access leisure centre spaces and to be physically active. So, for example, people talked about the lack of public transport immediately outside the leisure centre, the fact that community transport options were quite rigid and unreliable, that taxis were expensive and out of reach, that disabled parking was limited and finite, that there were more options through membership, but that was expensive. There were more options through ringing a bell, but not many people knew that. Toilets, again, was a really one that people often came back to, which again isn't necessarily something people would immediately think of if they were thinking about physical activity participation, but it makes sense. If you can't use a toilet somewhere, you're not going to go there, however brilliant the sessions might be, or however brilliant the kind of pool pod or other more obvious facilities perhaps might be. So people talked about things like the disabled toilets and the communal toilet. They felt being too small and narrow. There wasn't sort of space to move around those. And although there was more accessible toilets upstairs, they needed a radar key and they were relatively inaccessible because they were upstairs. And again, I think this was really highlighted through the method, was not just looking at facilities in isolation, which I think unfortunately is often how spaces like leisure centres are planned. Okay, well, we've got the disabled toilet. That's accessible, that's that box ticked. But what this research really highlighted was about how people move around a space and the difficulties of people moving around spaces, and how different occupations and spaces interconnected, and how that interconnection and that movement around a space revealed certain barriers as well as certain enablers. So again, there's just some quotes there to illustrate that theme. And yeah, as I've said, this theme really highlighted this sort of interconnected nature. And we can make links there perhaps with things like the POP model, those of you that perhaps particularly use that. And also potentially some of the literature around practice theory, really acknowledging the sort of practices that surround people's participation in occupation. That does align particularly with some of the literature Jodie talked about at the start around previous research that highlighted sort of things like parking and toilets as being very central to disabled people accessing leisure centre spaces and other public sports facilities. And again, I think there's some really interesting links here with occupational justice and perhaps particularly occupational marginalisation, you know, this sense of people being very limited in choices and control in terms of the occupations they're engaging and how they can then perhaps move around spaces. Okay, back to Jodie, who's going to carry on with two other themes.
So kind of building on from the kind of physical and mental barriers that Anna's just spoken about, something we kept coming across within our discussions was this idea of trade-offs. And so we've kind of referred to a trade-off as areas where there's been kind of a sacrifice or a compromise made in order to kind of help a majority group, but it doesn't actually take into consideration the minority groups and the negative impact that these trade-offs might have elsewhere. So a few of these examples were the placement of the stairs and the lifts. So obviously a big initiative that's kind of happening everywhere is this idea of we need to be more physical active, we need to increase physical activity. And so when you go into these public spaces, especially within leisure centres, you'll have all of the stairs placed right at the entrance to encourage people to use the stairs. And then the lifts will be kind of placed and hidden around a corner somewhere. And so if you can only walk so far, or you walk with a stick, or you use a wheelchair, kind of having to then navigate yourself around a potentially unfamiliar space to try and find a lift to get access of the whole the whole place can be quite frustrating. But yeah, so that's kind of one example. Another thing that kind of got highlighted was this idea of aesthetics over practicality. So, you know, going into a place and having these really fancy looking chairs that are really low to the ground with no arms or no back to the chair. You know, they're really impractical for many people that can't sit low down or struggle to get themselves back up. And so, you know, it's kind of, again, that idea of a trade-off. There was another one kind of looking at poolside seating, you know, so you can view the pool and watch events, but, you know, the disabled seating area was kind of placed in quite an awkward position, which meant that if you need to be using kind of the disabled seating area, you can't potentially enjoy the experience of watching the poolside, or you have to turn yourself at an awkward angle to be able to actually see what you need to see. And it's kind of that lack of thought, you know, oh, we've got our disabled seating area, that's fine, that's done, but there's no actual consideration to the, you know, the experience had in that position. There was a lot of talk, as Anna said, in and around the toilets, and one thing that kept being raised in particular was there was a disabled toilet with a baby changing facilities within it, and the placement of the bin meant you couldn't maneuver your wheelchair around the disabled toilet. I don't think the toilet was raised, and there was handlebars in awkward places, and the soap dispenser wasn't reachable, and so, you know, they've kind of tried to combine two groups of people with completely different needs into one space, and it's, you know, that those kind of trade-offs can be quite undermining for some, and you have to, you know, so that was another example. And then there's so many to keep going on about, but just and one in particular, I'll go to this last one, looking at the size of the groups specifically potentially within Sport for Confidence, because obviously it's seen as quite a successful thing, you know, starting from the beginning. You have small small groups, small sessions, and then as the company or the charity gets bigger, you get more interest, more people participating, and you get larger groups. That in itself can be quite a big barrier for some people, especially those struggling potentially with anxiety. And so that becomes another barrier, but obviously it is in other ways seen as a success. So it's just kind of being aware of how things are experienced by multiple people, and yeah, that idea of trade-off. So I've got a couple of quotes here. Yeah, so this one here by Amelia and Jess, the idea of being stuck to one side is a bit like an afterthought. You know, there's one thing having the physical barriers, but it's then the emotional implications those physical barriers have, especially if you're constantly having to come across them. And yeah, just kind of all of that, you know, it's trade-off to increase physical activity but decrease accessibility. That was very much directed at the placement of the stairs and the lifts.
We should say here, actually, sorry, when they're not talking about when they're saying things like they're talking about the leisure centre, that people weren't being critical here of Sport for Confidence. I think it's quite important.
Sorry. No,
that's all right. No, it's all right.
All very much kind of, yeah, you know, throughout the interviews, these ones in particular, they were moving around the leisure centre, talking about their experience of physical barriers within the leisure centre more so, and all of these barriers often you can see within the wider literature in other public spaces and not leisure centres as well. So there's a common theme as to potential trade-offs and barriers that you see, not just in leisure centres, but in a plethora of places. Yeah, so, and then going into our final theme here, this is kind of, we had our process of participation as our kind of overarching theme, and this is our kind of theme of solutions, if you like. So, you know, throughout all of our conversations, there was a lot highlighted in terms of, or we could just do this, or if you were to do that, and it would kind of improve people's experiences within a leisure centre. And so joining the dots, we felt, was a very apt way to describe this theme, because a lot of the barriers could be overcome just through kind of communications or different systems working together to try and facilitate inclusion for everyone, and really try and double down on potential barriers that there are. So here are a list of different ideas that were kind of thrown around, and there were so many ideas of ways we can kind of improve accessibility within a leisure centre. And the first one in particular was just communication from the leisure centre to those living with a disability or long-term health condition, you know, having kind of like flyers, places, to try and highlight, you know, where things are accessible, where the toilets are, or particularly with the parking, you know, there's quite limited parking in and around the leisure centre, and so kind of highlighting that even if you don't have a membership, you can access our underground parking if you have a disability. This was something that wasn't known by many of our co-researchers, but it was something that was available at the leisure centre. So, you know, things like that can kind of highlight what is accessible to those that need it could be really useful. And another idea that was kind of thrown around is, you know, within restaurants and things, you have your hygiene ratings, potentially within public spaces, having this idea of accessibility ratings or grading systems, so that prior to going to a public space like a leisure centre, you have a grading, so somebody with a disability with a wheelchair knows when they're going somewhere, they're going to be able to cater for my needs. I'm not going to be kind of left at the door and unable to access the area. So yeah, and there's lots of ways you can kind of do that. And then another big conversation and topic was in and around travel and transport connections. So there's one thing, there not being a lot of disabled parking, and then there's another thing, not having a bus stop anywhere near the leisure centre. So those who potentially can't drive or you know, need to use public transport but can only, you know, can't self-propel as too far or whatnot, you know, having a bus stop nearby would be really, really useful and really facilitate people's engagement in using the leisure centre and things like that. And we also, there's the community transport, which is a great kind of intervention, but it's, as we found, it was quite unreliable, as we had some participants just not show up some weeks because their community transport didn't turn up. So it's things like that that really can be a big barrier that needs to kind of be overcome. And yeah, just sport for confidence, potentially working with disabled communities, just bring more in, and potentially advise and work with the leisure centre staff to try and help them understand how to engage with people with a disability and how to potentially promote accessibility and inclusion within the leisure centre as a whole, and not just from the sport for confidence staff. And then looking at a bigger kind of on the bigger scheme of things, you know, prior to setting up a leisure centre, you know, working with and talking and consulting with kind of the disabled population to try and understand, right, how can we set up a disabled toilet that's going to be fully accessible, you know, where, like, location wise, where should it be, so that when you're kind of putting the plans to buildings in, we have kind of regulations and ideas of how to lay it out without and overcome the barriers before they're in place, if that makes sense, because that would make a lot of things a lot easier. And yeah, just in general, just training within the leisure centre staff, make them aware of the correct practices and potentially how to adapt their sessions to those with a disability. So yeah, I think that's pretty much that there.
Thank you, Jodie. So I'm just going to finish off very briefly now by just giving a sense for thoughts for implications for occupational therapy practice and also potentially further areas of research. So something that's talked a lot and utilised by sport for confidence occupational therapists is a whole system approach. I don't know how familiar people are with whole system approaches. They're increasingly utilised within the field of public health for to address issues like physical inactivity. And I think this research really confirmed that was the direction to to be going in terms of really aligning with this sense of the interconnected nature of people's occupations and participation in physical activity, that there's a need for occupational therapists to work across different settings and systems to enable accessibility for disabled people. So what we mean by that when we're using those kind of ways of working is not that occupational therapists aren't just focusing on kind of individual interventions, but they're also doing work to bring together different systems and settings, you know, to potentially challenge things like transport systems and locations of bus stops and number of disabled parking spaces, and trying to change and better connect areas of the system to ultimately support accessibility and participation for disabled people. There's definitely a sense from this research that meeting the needs of individuals and marginalised groups is really complex work, and that there are multiple tensions and trade-offs, you know, that often when it comes to leisure centres, designing leisure centres in the first place, there's this sense of a one size fits all for disabled people, that, you know, they'll build disabled toilets in certain ways, but then in funny locations, or vice versa. And the occupational therapist then often has to be involved in kind of trying to adapt and modify as best they can. But that, you know, there's lots of different competing priorities and trade-offs, as we said. And as I said earlier, just a need really through further research, particularly to better understand the factors that influence people to initiate, maintain, and cease participation in physical activity and other related occupations. So we can really use that not just to inform practice, but quite critically to inform policy as well. And that brings us to the end, I think, really, doesn't it, Jodie?
Yes.
We've got a couple of reference slides. And any questions, and then we did have some potential discussion points as well, that we could, I'll perhaps end the slides here now, but we can put those back up if people did want to have more of a discussion and stay on for some questions. I've got a question already from Lindsay. Go on, Lindsay.
Thanks, Anna. It's just more of an observation because I've got to shoot off, but I wanted to say thanks for the presentation. And then a couple of things that while you were both presenting that were really making me think was a shift. I'm starting to see a really positive shift, which is encouraging from hearing what your co-researchers have said around the leisure centre environments themselves and how they were rating how well that they thought they were doing when they were working with disabled people. And that was the Quest assessment that some of you might be familiar with, which is a bit like CQC in the NHS, and leisure centres have quests come in. And when I first started in the leisure centre, the quest assessment and the rating and the way those centres were being tested was on, do they have enough disabled parking spaces? Are the doors wide enough? Is there a lift? And the first quest assessment in Basildon, I met the quest assessor and I gathered lots and lots of feedback questionnaires from all our participants and asked for a meeting to share their feedback to help inform the assessment. And I was told that they weren't taking any feedback. There was a list of things that had to be ticked off. So that was 8 years ago. And now fast forward, Quest have changed all their assessment procedures. And now there are different modules where what they're looking at is people's experiences. And they're not just ticking boxes around the environment and adaptation. So I do feel that there are steps in the right direction. So I thought that was just a positive to share. I know there's still a long way to go.
I think generally, I don't know if Jodie would agree with this, but in terms of the leisure centre, people were generally actually really complimentary about the leisure centre. Putting aside the sport for confidence stuff, the leisure centre, people were generally complimentary about, but people weren't so complimentary about other, like people had experience within gyms, for example, people had experiences. And I think it is just that you can, the other thing is that we didn't say this, but that actually we probably should have done, the leisure centre was relatively modern. So actually it was quite a nice, accessible environment as leisure centre environments go, I would say. But I would agree with that, Lindsay. I think people were generally complimentary, but people were often drawing comparisons with other places and other spaces where they were trying to, you know, which weren't so great.
And that was going to be
Yeah.
my second point about the trade-offs. I mean, it's so brilliant to hear that come out, because we keep on talking about choice and opportunity and about celebrating difference, and that you cannot, just because you think you've provided for one particular group one particular opportunity, that is okay, and that people want choices. Some people want to be able to choose to go to a small group of people and spend time because that's where they feel comfortable. Other people might want to choose to go to a larger group. Some people would like to go to a group where they have peer support and maybe engaging in physical activity with someone who is in a similar situation to them. Somebody else might actually want to not be in that situation. But we've got to look at the choice and opportunities for people and not think, job done, there's something for you on a Wednesday. You know, and that's something that I think we need to keep on striving for, and pushing really hard. And then my last point was just to think about stuff that we've talked about in the past, Anna, about our role in social transformation as occupational therapists, and how it's so important that we can raise these points. And I know myself, sometimes I get focused on the actual delivery piece or what I'm doing in terms of an intervention, but I think the role that we can play is hugely important, and even more so important when it involves, you know, walking alongside people like you have in this research and elevating those voices to bring about a change. So really, really positive and lots to think about. Sorry, I can't stay for the rest of the discussion, but thank you.
So complex, and there's so many competing priorities, and also you're always working with a certain limited amount of resource, aren't you? So there's always, you know, like there was in this research, you know, in some ways we'd have done it in loads of different leisure centres and but we just didn't have the funding to do that. So, you know, and it's a similar thing, isn't it, when you're often trying to champion these things, you know, you can only work 5 days, so what are you going to give your 5 days to?
Yeah,
do you know what I mean? It's a tricky one.
Great. Yeah. Thank you very much,
Lindsay. Thanks.
Yeah, take care.
Any other questions? Thank you, Jack. Yep, Anna Maria.
I just wonder if you share these findings with the council or other institution that builds leisure center or other buildings or physical activity, because I just saw a new leisure center at the end of somewhere in Colchester near A12. They are building now a new center, and I was just wonder if when they did the plan for that one, they took in consideration all this problem, because I saw two leisure centers that they have only one toilet for disabled, and I don't know where they have the lift. I just wonder how people access that leisure.
Yeah, I think that's a really good point in terms of, you know, who do we share the findings with? Who do we seek to influence in terms of actively sharing the research findings with
because
people?
The toilet doors or other doors are quite narrow. So
and I know
everything you find in this research, it would be useful if you can share it with council or whoever is building these centers, so they can do the right thing from the beginning.
Yes.
You know.
Yeah. I think there was a lot of discussion with our co-researchers about ways you can kind of overcome it, and one of them was, you know, conversing with them prior to making the plans, but even just little ideas like having a leaflet, kind of planning out, you know, having a map of the leisure centre, identifying where the lifts are, where the toilets are, so that before you go you can have an idea of where you're going. Even things like that can make it a lot more accessible. But like you said, it's just getting it to the right ears to get things put in place.
And that was why the kite mark idea was interesting as well, wasn't it, Jodie? That people sort of described experiences of looking at a restaurant website and it's saying wheelchair accessible, and then they got there and there was a massive step in front of the building and it was like, oh, well, it's accessible once you're inside. And they're like, but how do I get in? And then they're like, oh, well, we could carry you up the stairs. And it's like, I don't want to be carried upstairs. You know, you insured if you drop me that. And people sort of saying, you know, it'd be great if there was some kind of recognized kite mark that, and I suppose Quest in a way that Lindsay was referring to sort of, but I think Quest is, I don't know how publicly available the sort of Quest assessment stuff is actually, but people were sort of saying it would be great to have some kind of like the hygiene rating, you know, they'll have sort of, I think it's out of 5, isn't it? And oh, they've got a, you know, an accessibility 5-star, great, I'll go there because I know that the disabled toilets will be great and there won't be any issues with access and those kind of things. That was quite an interesting idea, really.
Well, about this one, another. I saw. I was in holiday in a 5-star hotel, or they said it was 5-star because they had this 5-star according to the service they provide. But there wasn't a disabled toilet in that one.
Wow!
So, you know,
what, in the whole hotel?
Yeah, and
oh my goodness.
And the toilets were quite narrow, and I was thinking, okay, they can go there, even if it's for everyone, but they cannot use it because of the doors. So how can you enter? So you have to leave the door open, or the door was quite narrow anyway. So I was wondering, okay, how they have to use only the toilet in the room, or you know?
Yeah, exactly. Isabel?
Sorry, my son's around as well, so he's trying to get me to throw balls, which is fine. I'm a new starter of Sports for Confidence. I just started in July, so very early days. Thank you. But I thought so the actual self-rating scale for accessibility was actually a really good idea. And I know with we ended up having to do like a fire evacuation last week in Colchester. So we've been told about doing Jeeps, which are like sort of general, I think they're general emergency exit. I can't remember the final acronym, but it also sort of transpired that some of the sessions, that some of the Sports for Confidence sessions are limited with like the evacuation chairs and stuff, the fire entry, for example. So before individual even comes into sort of the centre, if they've not perhaps booked on, or if someone else has booked on with an additional need, they may not be able to access the session around like the fire safety and flare evacuation. So it's quite interesting and fitting with what you were kind of saying as well.
That is a really interesting example.
Accessibility sort of standpoint. But no, really interesting. So thank you.
That is interesting. Thank you, Isabel. And we've got a question in the chat too, I think, from Ahmed.
It's a bit noisy where I am, so I typed out the question.
Oh, that's okay.
It was all about a really nice presentation. Thank you very much. It was around the implementation of the recommendations and if there had been any studies around that. Because I think some of them can be, they come up quite a lot, like around transportation or building design. And I think it'd be interesting to know if people had experience around trying to get those implemented and the ease of those. So just wondered if you'd come across any studies around the implementation of those recommendations in the studies.
Which recommendations, sorry?
Around, for example, transportation and the ease for using whether public transportation or liaison, for example, with the local authorities and the council, with those type of things.
Jodie's probably best placed to answer than me because she's done the deeper dive into the literature, but off the top of my head, my sense is to say no, you know, that there isn't, is there, Jodie, in terms of research, when researchers recommended certain things like transportation, there hasn't then been further research done to see if those recommendations been implemented and how that's gone?
No, I haven't seen anything, in particular that has actually, looked into the success of different implementations. But there are lots of papers going, potentially do this, potentially do that. There was a paper that, really looked into kind of ramp accessibility on public transport and things like that. But I haven't come across anything in particular that has actually looked into applying these ideas in a real life scenario and how effective that is. But that is potentially something I could do a deeper dive into and look specifically into, because like I said, I've not come across it, but I haven't specifically looked at that. So that's a really good thing to flag. I'll see if there is anything that's, really kind of looked into how successful different things can be, because that would be really interesting actually, to see if there is anything. So yeah, thank you for that.
Andy?
Thank you, Anna and Jodie. It's been great to hear from you both today, and I'll look forward to perhaps having a separate conversation if it's possible, just as my role at Sport for Confidence involves heading out to the different leisure centres and talking with participants from a distance as well about their experiences. So it'd be great to understand more about the potential to use what you've learned and the kind of experiences that you've had to kind of take those forward into the role that I've got. I was interested to understand about the kind of the word accessible over inclusive. I know that the Quest uses or has been using the term inclusive fitness initiative to refer to leisure centres, and I don't know whether that's helpful or unhelpful, but I think Jodie, you talked to kind of like the psychological barriers as well, but does it, I think accessible but as somebody living with a disability is the right term to help people with a disability identify with, but is it been I just wondered if the thought around that, or whether it's the helping participants.
The word so as Jodie said, the sort of second strand grew quite organically out of the first strand, that quite quickly there was this sense of we were going to be trying out go along interviews, and co-researchers were like, oh well, what are we going to talk about? And they all decided they wanted to talk about their experiences of accessibility in a leisure centre environment, and accessibility was their word. And to be honest, Andy, I didn't ever question it with them, did we, Jodie? We never sort of said they kind of led the decision that this was going to be about accessibility, and they used that term. I don't remember them using the term inclusion, but it's a really good point, Andy. I'd never really we just sort of went with it, didn't we, Jodie? I don't remember.
There is a bit of discussion within the literature in terms of we throw around the word accessibility, what it actually means is so subjective. What's accessible to one person is completely inaccessible to another person, and that is something we really did explore. All of the barriers that we kind of looked across, everybody, even within our group, had different perspectives on each of the different barriers. So myself and one of the co-researchers looked at the baby changing disabled toilet, looked in there and said, nice and big, you've got both of it there, this looks like a good toilet. And then we went on to discuss the toilet with a couple of the other co-researchers, and they said, no, it's the worst disabled toilet in the building. The toilet's not raised, we can't do this, we can't do that. And so accessibility is so subjective, and there was a paper that I think it was something like 80% of the leisure centres that were looked at were deemed as accessible. But when you then actually did like a deeper dive into the facilities and the infrastructure that they had to make it accessible, they wouldn't have the adapted changing rooms, they wouldn't have a lift and all sorts. So it's really understand, I think we need, in terms of potentially infrastructure and layout, have a better idea of what accessibility is, what is considered accessible, and have like a standard of what we class as accessible, and a level of what we, which brings us back to, you know, the grading system of kind of like the hygiene ratings, having accessibility ratings as well. So I think that's definitely a conversation that needs to be had, so we're all on the same page as to what accessible really means. I hope that's a tangent.
We said frequently as well, it would have been great to have had more funding to do more workshops, because these are exactly the kind of conversations you could have then had space to have, you know, whereas, you know, this study could easily have been double, if not triple the length of time, couldn't it really, Jodie? Because we'd have loved to have had more, because we did have really fascinating discussions, but unfortunately we were always limited in the amount of workshops and discussions we could do with them.
Yeah. Well, thank you both. It's really useful, yeah, to hear thoughts on it, and and from the perspective of people who've acted as co-researchers as well. That's great. Thank you.
Thank you. Thanks, Andy. Sarah?
I'm not sure if Lindsay said this earlier when she was talking about Quest, but just what you were saying, Jodie, then about like the vastness of what accessibility could mean. Like when they go and do these Quest kind of assessments, do they take people with, do they include people with disabilities to make these assessments? Are they part of the team that assesses? Like, or is it, like you said, you went and thought, okay, that's an accessible toilet, but actually it wasn't that accessible?
I'm afraid I'd only have a kind of limited theoretical understanding of Quest. I've never been practically involved in a Quest assessment. I don't know if any of our Sport for Confidence OTs, sorry to put you on the spot, but those of you that are on the call, if you have been involved in Quest, is anyone able to answer Sarah's question about that?
I know Sarah, so a centre local to me, which is in the north of England, is going through a reassessment at the moment, but as far as I'm aware, I think the Quest assessment that's changed, it doesn't involve talking directly with people who use the centre or service,
okay.
which is interesting. And I think it is a voluntary assessment, and it's quite but I understand it's quite a difficult and lengthy assessment to go through. So it's not mandatory, which is interesting, you know, because if it was, people had to display the result like a hygiene rating. I think it would compel those centres to do more. But yeah, so yeah.
Thank you. Thanks, Andy. I'll try and find out a bit more for you, Sarah. I'll ask Lindsay because I know she's been involved in a lot of them, but thanks, Andy. Isabel?
How long was the sort of research sort of focus groups sort of spanning for?
How long did they last in terms of time, or how many weeks they stretched over?
How many weeks you stretched over?
Oh, we had our first one in February, end of February. Is that right, Jodie?
Yes.
And we had our last one last week, wasn't it?
Okay. So
Yeah.
Something like that about right, Jodie? I think that's about right.
Something like that. Yeah. I mean, I think the workshops we finished. When did we finish the workshops?
The data collection workshops. Yeah, true. Yeah. So we had sort of data collection workshop, planning and data collection workshops, and then we moved into analysis workshops. So that's what we've only just finished. Yeah, that's a good point, Jodie. Yeah.
Yeah, no, just interesting. So I know you were reflecting that perhaps if you had more funding, it would be sort of perhaps an opportunity to perhaps be at different leisure centres as well and see different views as well, isn't it? So, but no, it's really interesting. So
yeah, it would have been really interesting to do that. But one of the reasons we didn't have enough resource to do that. And also we didn't really, for a participatory research project, we didn't actually have that much time with people. And that was one of the reasons why we decided to sort of piggyback the sessions, because it gave us another opportunity to connect and build relationships with people, as well as Jodie and I experiencing some of what they experienced. I mean, as I said at the start of the call, I do work part-time for Sport for Confidence, but it was a new organisation to Jodie. So I think and actually my role doesn't involve me being in leisure centre sessions very often at all. So I felt like that was really useful for both of us to understand, but also to build connections and momentum that then carried through into the research. So yeah. Sarah?
Just kind of thinking of this like whole system approach when we're kind of like, say if we so I've got my placement in like a learning disability community service at the moment, so we do like recommend, say, sports for confidence and things as possible interventions, but obviously there are people that be like, oh no, I don't fancy that, or I don't want to go to the leisure centre, and I guess my question is, like, when we're as OTs, when we're giving these suggestions of like possible interventions, how much of the kind of the whole system approach should we explain at that point? For example, oh, there might be someone you can speak to in the leisure centre, or this place has right outside of it, or is it up to, I guess, the person that we're suggesting it to find these things out? Like, yeah.
I think I would say I'd see a whole system approach as being much more about how the occupational therapist is thinking and working, that they're not just, but I appreciate it's easy for me to sit here and say this. I'm not the one with a massive caseload and really limited time to buzz around sitting on boards and meetings, persuading transport providers to locate bus stops in different places and all, those sort of more peripheral contextual things that need to happen, but in reality, when you've got a caseload of people with individual needs that you need to, I can completely understand how those things drop down the priority list. But I think there are opportunities. Interestingly, within that joining the dots, one of the things people did also talk quite a bit about, Jodie, wasn't it, was how can disabled people become more visible within organisations, in employed roles, on boards, those kind of things, so that they can also influence things like leisure centre design, like Anna Marie was saying. They can inform Quest assessments like you were asking about before. They could potentially help with some of those system type issues and address those points really and difficulties. Does that answer your question?
Yeah, in some respect, I guess. Also, just like, how do we kind of reassure someone that they are going to be able to participate in what we're suggesting, kind of thing?
I think one of the big things that everybody kind of said is, that first step in, participating is probably the biggest and hardest step for everybody to take. And so it's knowing how to support people to take that first step without doing too much or doing too little. And I think, that first step, I mean, encouragement was something that everyone says isn't just what you need to facilitate that first step. Encouragement is something that you need to keep you going and keep you coming back and then create that habit. But having that kind of point of contact during making that first step was really big, and just having as much information as you can going into a leisure centre. So kind of, I think one of the big not fears, but kind of the more mental barriers that we came across is the unknown. And people with a disability might have, either if it's lifelong, might not have ever stepped foot in a leisure centre before, or have some poor previous experiences. So that brings up a whole load of different kind of negative emotions. And sometimes buddying up with someone, going with someone, or meeting someone there, or knowing who you're meeting and knowing people there prior to yourself going, or knowing a bit more about the leisure centre in general prior to going, you know, knowing that you've got the parking there, knowing that you're going to be able to get in and get where you need to without having to ask too many people for help and come across too many other barriers is really kind of pivotal in making that first step. So I think just encouragement and making sure they have as much support, kind of one-on-one support with them within that first step. I don't know if that helps as well with your question in terms of encouraging.
I think what as well was actually really exemplified in our group of co-researchers is the importance of those. So for example, there was someone who had come along to Sport for Confidence because someone else who was already a participant had persuaded them to, and they were initially really reluctant and resistant and said, you know, people will laugh, and the other person was like, no, they won't, you know, come along, and you know, and had almost dragged them along in a positive way, really. And I think there is that powerfulness that comes not just from being the occupational therapist and supporting people, but also the fact that people have positive experiences and then talk to other people about those positive experiences, and then more and more people come along and go, okay, well, if you're going every week and having a good time, well, I'll come and have some of that as well, thanks so much. So that sort of peer-to-peer influence as well.
Yeah, it means so much more, doesn't it, when it comes from your peers, because you know it's someone who understands better, they have a better understanding and a better experience. So when it comes from someone that you almost trust their opinion a bit better when it's your peer, I suppose, isn't it? So, yeah.
Michelle?
Oh yeah, so just sort of in response to Sarah, actually, in terms of how we work with people, it's certainly, it encompasses everything. So yeah, we would have those conversations, and it is all about having those conversations, and about, you know, certain things. You know, we would assess them, obviously assess their needs in a sort of a clinical way, but obviously when we're one-to-one with that person, it might be that, say, somebody's double incontinent, and we know that they're very conscious about being able to swim and being able to toilet before they swim. So it might be, you know, we have that conversation, the bathroom. So on a visit, I'm very aware that my priority is to say, oh, these are where our bathrooms are, you know, three areas. And obviously identifying what people are interested in. So it is very, I don't want to use the word, but it's very person-centered. It's very focused on that individual, and I guess it is all about how we work with that person as that individual in the leisure centre, in what they want to achieve and what they want to kind of engage in, really.
So you'd always
Thank you, Michelle.
Like suggesting people go that they'd always contact an OT there first rather than just going to an open session.
Yeah, so we have a referral system that's in place. So that is one of the steps that we kind of need to make sure that we're grading that person in correctly. So it's a positive experience and something that they would like to maintain, and it's tailored for them. And obviously we will then adapt the session around their needs, and if they, for example, might need certain social support, like you were suggesting, in terms of peer support, if they know someone already, or if we know that they need a gradual exposure to the environment or the group itself, we might say, for example, for somebody, we might suggest telephone calls with us to build that rapport. And if they're quite anxious, then the next step may be a visit to the centre, and I've done a half visit and a full visit before as well, so that's the next step. They'd meet us, and then the second time they'd come around, they'd look at the centre itself and where everything is and get used to it. So yeah, very, very specific to those that individual's needs.
I think that sort of initial personalised support is what came through as so critical within the process of participation, you know, that having that made the difference between people joining or not joining, or coming along to the leisure centre or not coming along. And even the adaptations, because actually people also reflected on sort of the adaptations and the encouragement and Sport for Confidence sessions in comparison to the open perhaps sessions some of them attend, and said in those sessions they'll just be told things like, just do what you can, and that they felt that sort of marginalised them. There wasn't an effort to advise in terms of, will you do this perhaps instead, or do this bit of that, and people felt like that sort of highlighted them as different. To just say, well, do what you can, and potentially, you know, then they're sort of sitting there for considerable chunks of a group session not really doing anything because no one's supporting them to do that. So yeah. Okay. We've taken up quite a bit of time already, so I don't know, and we've covered a lot of stuff that probably were things we would have covered in the discussion point. But something we were really interested to ask is whether people felt the finding, you know, obviously the findings in our research were very particular to a leisure centre, very particular to one leisure centre space, although, as we said to Lindsay, people did bring in experiences from other places, including environments like restaurants and non-leisure centre spaces. But particularly perhaps for those occupational therapists that aren't working at Sport for Confidence in a leisure centre space, we were interested to know if the issues we'd described and talked about this evening sort of that you feel map to other public places. You know, do you think these sort of things are things that come up in discussions with service users, or perhaps some of your own experiences around accessibility? Nicola? Oh, I think you're still on mute.
Sorry about that, sorry. I've just started working for Sport for Confidence. So I'm very, very new. I've only just sort of done 2 introductory days. But I have been an occupational therapist for a long time and worked with people with long-term conditions, and in particular, people with motor neuron disease. And one of the reports that, well, we get reports frequently from patients going into hospital with motor neuron disease and not having access to things like nurse call. And I was involved in a project with some hospitals to try and set up accessible nurse call. So, I mean, when you think a hospital would be, you'd think would be the environment that people could access things.
Yeah.
And I think people with long-term conditions do tend to get overlooked in hospitals. And the other report, the big report as well, is people with no communication being overlooked in hospitals. And if they have a communication device, not being able to take that device into hospital with them, not always being able to, and then again, not being approached for things, just basic needs, you know, like drinks being left at the end of the bed, food being left at the end of the bed. So sadly, you know, even in today, that's happening. And there has been work done, you know, particularly from the Motor Neuron Disease Association and specialist MNDA nurses, but I think it does still happen, sadly.
That's really interesting, because actually I hadn't, when we'd put that question together, I wasn't really thinking about hospitals, but you raise a really good point. Yeah, that you just sort of assume perhaps there'll be more accessible environments, but they're not. I suppose particularly some of the hospitals that are still located in very old buildings that weren't even, you know.
And I think it's awareness as well, that because I mean, we had a situation, it was actually Basildon Hospital, where I had a patient that went into Basildon Hospital and had no means of accessing their nurse call. But when I was contacted by a family member, and when I've contacted Basildon Hospital Estates and looked into their nurse call system, it turns out that a switch could actually be used in the nurse
Right.
call system for them, but nobody knew. People just didn't know. You know,
Okay.
it's just that awareness that people working with the client didn't know that this nurse call system could do these things. So some of the modern hospitals have got them, but it's just about, you know, knowing about them and knowing, you know, that the staff don't know, don't realise, and don't know that there are adaptive switches that people could press. But, you know, they're just not. So it's about education as well, really.
Yeah. Thank you. Thanks for that, Nicola.
Thank you. And thank you. That's really interesting study and
Good.
really helpful.
Good. Isabel?
Sorry. I was also, I suppose, similar to what Nikki was saying, sort of with, I was in an intermediate care sort of setting, and part of that was sort of for 3 weeks, recommended 3 weeks of intensive rehab as a stepping stone from sort of hospital to home. But we had like sort of a sheet which had about sort of their, if they had any adapted aids, such as like sort of hearing aids or glasses, walking stick, or how they ambulated. And that was really useful, because I think sometimes sort of if they're not aware of, they're not wearing or using what they should be to give them the best chance to sort of engage, then that's the barrier in itself. And sometimes we can't just rely that they're doing it themselves. So it was that prompting and making sure they actually have the right specs, for example, because sometimes they pick up someone else's because it was in the eye line. So yeah, it's a bit of a digression, but it's still so relevant.
Yeah. No, it's really interesting. Yeah. Thank you. Okay. I don't think, did we have anything further, Jodie, you wanted to say?
No, I don't think so.
Just to say thanks ever so much. It has been such a privilege to do this study, and I think we just both feel like we've just learnt so much from kind of having this privilege of a space to really talk in quite some depth and to really understand, you know, even as someone sort of shows you about, one of the really powerful things was someone showing me how they sort of pushed through doors in the leisure centre in a self-propelling wheelchair backwards using their shoulders if there wasn't a button, you know, and how sort of hazardous and difficult that was, because that was the only way they could move through a space on their own if no one was around and there weren't automatic doors. And I just, you know, I think often we felt with this study we'd have never got to the understanding and the data we'd got to if we hadn't been in the space with people sort of showing and telling and moving around. You know, you just never have got to the same kind of information. Yeah. We are planning to write both strands up for publication. We're in the process of doing that at the moment. So look out for that.
Yeah.
And make them public somehow so they can reach to the people that they really need to take it into
I only publish
consideration.
open access, Anna Marie. I make quite a thing of that because my research is participatory. All of my publications are open access, so you know I don't tend to hide things behind paywalls. So yeah.
Okay, thank you very much for tonight and for your information that you
thank you. Thanks ever so much for coming along. It's been brilliant. Thank you.
Thank you.
Thanks so much.
Bye. Have a nice evening.
Thank you very much. Thank you.
Thanks everyone. Bye-bye.
Bye.
Bye.
Thanks so much, both.
Thanks, Andy. Thanks for your technical support.
Well, I'm going to end the call, and I hope it's still. I hope the recording doesn't disappear. I don't know
or you cut
where it goes.
Jodie and I as well. We'll just disappear.
Yeah. We'll just disappear. Yeah.
No, thank you. I really appreciate that.
No problem at all. And thanks so much, both. It's been great to hear about the work, and it's been great to talk more about it.
It's been great to hear, because I suppose Jodie and I have been so immersed in it over the last month. I think when you start talking to other people about it and they start asking questions, it brings it on again, doesn't it? Because you suddenly think, oh yeah, we did, like, that was a really interesting question about accessibility and inclusion, but I'd never questioned the word accessibility. It's a really interesting point.
Yeah, I could always say, I think I went up to speak to the snooker championship in York, in Sheffield, and then I spoke. I used the word accessible, and then when I heard, the representative for World Disability Billiard Snooker, it's the right term. I can't. They used the word inclusion or everything being inclusive, and I was like, oh, well, that's interesting. I'm not. Yeah, and I think I would identify more closely with the word accessible. So I was pleased to hear something you talked to participants about.
Yeah, we are going to have a final kind of workshop with them, so actually that might be a really interesting thing to try and discuss with them then.
Definitely agree that,
because it will be nice. I think what will be nice is we can take back, like we can say, we've been presenting it and these are the kind of things people asked and people are interested in this. It'll be quite nice for them to know that it's generating these kind of discussions and questions.
Well, it's certainly been well received, and thanks so much. And for your thoughts, Jodie, on the first point of contact and that encouragement is so key. I can identify with that. Really, but and be brilliant to how what's possible to take forward in I suppose as a sport for confidence employee, what to be able to do, utilize the kind of tools that you've identified in the research to take forward to explore participants' experiences and be able to get their feedback across more of the learning centres, I hope. So brilliant. Thanks so much.
Thank you, Andy. Lovely to see you.
You too, and nice to meet you, Jodie. That's why if I just press leave, I think that it's going to tell me
I think you'll be all right. I don't think
it'll end the call for both of yourselves.
We'll send you an angry email.
It doesn't matter. We don't need to record our bit. We don't need to record our bit anyway, so don't worry. If it stops the recording, it stops the recording. I'm not worried about that.
Okay, right, no
but I
problem.